So I took him down to Ginger's son's place, and he got to spend a couple hours with him last year doing that.
Where is that?
Do you know where Sutherland's is? Okay, it's just across from Sutherland's at Joy Street.
The new one? The new one they just turned into? Well, no. I mean, the new business they turned into a detailing business.
No, not the new
Should we
one.
get started?
This is down there on Joy Street.
All right, let's go ahead and get started for the day, guys. April 10th, is that right? Happy Easter, happy Passover. Those are the two holidays I think that are currently going on. So enjoy time with your family. I advise you not to go into a church, those of you who live in Kansas. A couple things. I found some really cool stuff when I was doing research. I'm walking up because I want to show this. You go to the CDC's website, they have a nice little package called CARE. And it's for your patients and probably all of you. And what I recommend is you go there, print this out, then make copies of the page. This tells you just very basic stuff about what to do when you get sick. They have a nice little log, and they'll teach you how to record your fevers and your symptoms. So, if you need to be in discussion with your physician during this time, if there's a concern, you see the fever's going up or symptoms worsening, and you and your physician make a decision to go to the emergency room, that'll be helpful because they'll want this information. So, very helpful for people to be tracking their own symptoms. A couple follow-ups. So, I can't remember, it was a day or two ago, we talked about plasma. So I just saw this today, first in nation ever, placed through, I think, it's a community plasma center, but I think Mayo Clinic is running this. They're actually taking convalescent plasma out of patients and now treating people. So I don't know their protocol, and I don't know the safety, but I assume they're doing all the appropriate safety testing for other viruses, hepatitis C, HIV, and such that we talked about. It'll be really intriguing to see how that comes out. I have not looked up how they're doing the clinical study, whether it's truly a randomized double-blind placebo-controlled trial or whether they're just going to treat sick patients. But, it'll be interesting. So, good questions, guys. These are real-life issues. Just a plug on masks. Our hospitals do a great job of wearing masks. And I want you guys to realize a couple things. This is not just, we're telling you to wear a mask because it might be good. There's scientific evidence that this is appropriate. And the biggest thing you need to understand is it does protect you, but it actually does more to protect everybody else against you. And that's basically what the science says. So a lot of you guys might be silent carriers, or you may be getting over coronavirus or just getting it and not even know you have it yet. Yet if you start coughing and you're not wearing a mask, the droplets and everything around you are highly contagious. And so again, it's your community service to your family, friends, colleagues, and your community to wear your mask as much as possible. I personally wear it 100% of the time. I walk my dogs with it. I run with it. I go for Jeep rides with it. That doesn't mean if there's nobody else around, theoretically, it's really difficult if I have the virus for that to float around and find you 10 miles away. Within reason, guys. You can go mushroom picking by yourself, probably without a mask on. Things like that. All right, so we're going to get to topics. So I spent a lot of the morning doing my best to research these, understand some of these. I'm second-hand, third-hand knowledge to you guys, but what I'll try to do is at least make the common sense connection and why people are bringing these up. First thing I want to do is that one of my patients emailed me from Hiawatha, Kansas, and said, hey, what's going on? Don't you think vaping and this kind of stuff is bad? Yeah, anything you put in your lungs that God didn't put there is probably not good for you. So, is there a good time to quit smoking? Today is a good day. Is there a good time to quit vaping? Today is a good day. Because while we don't have science, we do know that smoking and vaping are going to be high on the comorbidity list that leads to bad outcomes. And people will say, well, I've done it for 30 years. Why should I quit today? Well, if you give your lungs 2 weeks head start, that's 2 weeks more than it had otherwise. So there's a good chance that it might help. And it doesn't hurt to try it. Plus, it's expensive, and There's a lot of other reasons. So, yes. Is this bad for you? Yes. What about marijuana and CBD? I've seen stuff on that too. Again, if you're getting these through your lungs, probably not a good entry point. I won't comment on marijuana for obvious reasons, because the people that are watching this are in different states, and states have different laws. CBD, I suppose you could vape CBD, but CBD is pretty doggone safe to use topically or as a pill form. Whether it helps you or not, or helps coronavirus, I have zero knowledge of that. I have seen the headlines just like some of you guys have. But just avoid putting any of these substances in your lungs for a couple months, okay? All right. So everybody's good on that one. How about ibuprofen and non-steroidals? So this was interesting because I hadn't even bothered to look up what the hype was. But about a month ago, there was a Lancet. So Lancet is kind of the European version of New England Journal of Medicine. So it's a pretty well-respected journal that made a whole bunch of claims. And they were making claims about comorbidities, why people with hypertension, why people who smoke, why people with diabetes seem to have a higher mortality rate. And they also mentioned something about anti-inflammatories. And the media caught on to this. The French government released a statement basically saying it was dangerous. And, basically it was observational data. So we talked about data the other day. The best scientific data for drugs in humans for a certain thing is a randomized double-blind placebo-controlled trial. Most of that comes, you got to start somewhere. And again, scientists look around them and we make observations. So that's a legitimate form of data. And nobody's going to fault somebody for collecting data on real life. And that's basically what they were seeing, is that there may be a little bit of increased death rate in people who are on non-steroidals. Scientifically, are they on non-steroidals because they have an underlying condition that might put them at a higher death rate due to coronavirus? Maybe. Biologically, is there something about the Advil or ibuprofen that actually increases the risk? Well, we do know from past SARS infections that when the virus enters your lung, it actually induces cyclooxygenase and other pathways that are anti-inflammatory for a purpose, because we want them to fight the virus right there. And if you're taking drugs that slow that down, theoretically that's a hypothesis that might have a biologic effect. But it could easily be a confounding effect if somebody takes ibuprofen because they have bad knees or they, whatever. So the FDA has guidance, and a lot of people have guidance, and it basically says if you're at home and you have fevers, at this point it seems like Tylenol is the safest bet. And it's really hard to have problems with Tylenol at doses up to 3,000 milligrams a day, which would be 2 extra strength Tylenol every 8 hours, or you can figure out the math and different derivatives of that. And that's what I would start with when you guys are at home with your fevers, okay? And if you need an ibuprofen because your fever's 104, well, then you got to take a little microscopic risk-benefit ratio. And is it dangerous to have your brain cooking with fevers that high versus, are you going to give the virus a little head start? Well, my guess is it's going to be important to bring your fever down. And so taking a couple ibuprofens probably wins that risk-benefit decision at that time. So start with Tylenol, and if you need a non-steroidal, it's probably relatively low risk. Fair enough? You guys good on that answer? The bottom line is every expert says we have no good scientific answer to that question. So use common sense. All right. Blood types became very interesting to me because I saw this come across the wire 3 or 4 weeks ago. And I want to write down the data because I think it's cool. There is an early publication. So a lot of what's going on now is people are rushing to get their papers out. And there's ways to publish papers that are not through a typical peer review process. Most papers for legitimate scientific journals, you submit the paper, it gets sent out to a couple peer reviewers, people that understand the science and behind it, and they comment on it. They tell the editorial board whether it's good, bad, or it could be good if they made a few changes, and that takes months. These people are dropping their papers at websites that will basically make them accessible immediately. and then they're doing peer review on the back end, which is fine. Again, it's the car wreck analogy. If we're in an emergency and there could be good data or something good to help save people, then let's get it out there. As long as the safety, we take that into consideration. And when we're doing observational things like whether blood types might pose a risk, there's nothing we can do about our blood type. None of us are going to go get a bone marrow transplant to change our blood type. So it's just interesting. If anything, it might make you feel more secure or less secure depending on your blood type. But for those of you that know your blood type, I thought you'd want to know what the data shows. So we'll do that real quick. You guys are aware there's 4 types. There's 4 blood types, right? AB, A, B, and O. And I'm not doing the plus or minus because that's the RH factor. That's the ROGAM things. For whenever you have babies, they test you for that. I don't think that has a role in this one. So we're just talking about the basic AB blood types. These are Chinese data, so I have no idea what American data are. But in the Chinese population that was tested, let's see, 31% of people have type A blood, 24% have type B, 9% are AB, and 34 are O. By the way, this is a plug for the the Red Cross, not the Blue Cross, the Red Cross, that they will desperately, if they're not already, need blood donors. So, is it safe to donate blood? Yeah, I would say the Red Cross is probably about as safe as you can be. So, if you're looking for something to do next week and you got a day off, go donate a pint or 2 of blood. So this is the Chinese population just normally. And then they looked at mortality of people based on blood type. And this became interesting. So 38% were type A, 26 were B, 10 were AB. So you notice immediately something's drawing the levels up when you have these types. And then as you might guess, O is significantly lower. So not only are you a universal donor, but if this hypothesis is correct, you may have a protective effect of your blood type. Now, why would that be? Well, in blood types, you remember that, and you may not remember, I don't know whether it's going to show up or not, but there's a nice little picture on there, and I'll pass it around when I'm done. That if you're A, you have antibodies against B. If you're B, you have antibodies against A. If you're AB, against A. If you're AB, you don't have any antibodies. And if you're O, you have antibodies against A and B, right? And that's why, and if you have an antibody against A or B, that's why you can't get their blood, okay? Because you'll reject their blood. O is a universal donor because nobody else they don't have any antigens on their surface, so there's nothing for your immune system to react to. AB is a universal recipient because they don't make antibodies against either. But for some reason, having antibodies against both of them looks protective. And is one of these better than the other? Maybe it's anti-B, the A blood group. Maybe there's something about this one that seems better because, again, this difference, these are small differences, although detectable. This is a bigger difference, and that's the biggest difference. So maybe they're speculating, they're hypothesizing. That's how scientists do it. They make an observation from observational data, and then they hypothesize. Well, these are clearly different statistically. Not huge. It's not an on-off button. You're not going to live through. Not everybody with O blood type is going to live. Right? If you have comorbidities, that's going to trump it. But this is a pretty significant change in your percent mortality, or what's left. So there probably is something behind this, and we'll probably know 6 months or a year after we analyze the European and the American data too, which will be important for future coronavirus infections maybe. So is the science worth it? Yeah. Can you guys change your blood type? No. A lot of you probably know your blood type, particularly women who have given birth, and they know at least the RH status, or if you've ever been told you're anemic. But that's where that came from, and I thought that was pretty interesting. So that was a really good question. Which leads us to the next question. Male gender versus female gender. So, depending on the population at risk, let's say females over here, males over here. In some populations, there's a 50% increase, meaning if there's 100 women that die from coronavirus, for every 100 women, 150 men die. And then there's some populations in our world where if 100 women die, 200 men die. So, does it have anything to do with the Y chromosome? Well, for all you women out there, it probably does because we're stupid. But realistically, it's really hard to parse down scientifically what it is about being a man that puts you at a higher risk for dying. Because there's so many what we call confounding variables, meaning men tend to smoke more. Men tend to not do social distancing as well as women. Men tend to hang out with their buddies and drink beer, in groups greater than 10. Men tend to smoke, and all these things. Men tend to have more hypertension. Men tend to have more heart disease, which are also known to be the other risk factors. Okay? So it's hard to say there's anything about having a Y chromosome that by itself is a risk factor. And that's where scientists just say it's an interesting observation. But that one's even hard to start with. Okay? So yeah, men probably are dying at a higher rate than women. And there's probably a reason, but I have no idea what that reason is. And my guess is it's one of the multiple confounding factors. Okay, so this question came in today, and I kid you not, I was thinking about this driving to work this morning. Because I'm like, I wonder if the swimming pools are going to open this summer. From a public health standpoint, if we're still in lockdown, of course they're not. Because, you can't suntan next to somebody if they have coronavirus. But if you have a private pool, the CDC actually has already addressed this for us. And somewhere in my papers, I have the CDC's comments that basically, under normal conditions where you have chlorine or other additives in your pool, that very likely kills this virus. So basically they're saying, yeah, your swimming pool is safe. I did not look up saltwater pools, which is a new trend, and whether the saline concentrations are enough. But I have seen things regarding temperature. And the virus is more stable at cooler temperatures, and it's much less stable in the sun and warmer temperatures. Is that an impact on why things get better in the summer? Could be. Is it because kids social distance in the summer? Could be. But the answer to the question about swimming pools is, if you got one in your backyard, you're probably safe to open it and enjoy it. And consider yourself lucky. But don't invite friends over. Okay, everybody good with that one? Okay. Plaquenil and zinc. There's a couple of follow-up questions, and I've talked about Plaquenil a lot in here, and I'm not going to go through the whole story again, but I do want to read you a couple specific questions. The first one says, I'm on Plaquenil now twice a day. Would you recommend I stop it to give my immune system a chance to get stronger during the COVID-19 spread? One, I'm not your doctor, so I'm not going to tell you what to do. For my patients who are on Plaquenil, no, you keep taking it. One, because it's not that strong of an immune suppressant, and that's not truly what it's doing for lupus and rheumatoid arthritis. Okay? Technically, I would consider it an immune modifier, but that's splitting hairs. And you have no reason to stop it because that's what all the experts are yelling about. The panic of Plaquenil 2 weeks ago is it's not fair for us to redistribute our Plaquenil for a disease we have no idea whether it helps or not when we know there are people on it that are dependent on it. And I've been through that discussion before. Fortunately, the stockpiles have quickly caught up like we expected, and I don't know that there's any pharmacy that's short on Plaquenil now. Hospitals have loaded up on it. Our hospital is loaded up on it. My patients are telling me when I call them on the phone, they are no longer having trouble getting their Plaquenil. So I feel confident that that's not an issue anymore, or it won't be. And I don't feel that you should stop it to make your immune system better. Okay? On those lines, and I've said this before, I tell my patients all the time when they want a natural therapy to fix things. I'm like, that's fine, I don't care. I don't have any scientific proof to tell you natural therapy is good or bad. I will tell you this, though. There's a lot of places that sell immune boosters, right? And if you take an immune booster when your immune system's trying to attack you, maybe that's not a good idea, okay? You ever tried to put out a fire by throwing gas on it? It's not a good idea. So, again, this is a tricky virus. We need our immune system to develop protection, but at the same time, when the virus and the immune system are at full onslaught, the immune system is what's actually making us sick in our lungs. Okay? And so you got to be careful about trying to tinker with your immune system. I would leave that up to your individual doctor. And frankly, even as a specialist in these immune-based medicines, I struggle with what's the right thing to do. And colleagues around the world are emailing each other. I've emailed my colleagues in New York with what to do about lupus medicines and this already. Unfortunately, we talk to each other, and there are some groups out there that are making guidelines based on everybody's opinions. And opinions count for something when you don't have science. And you just hope they're right. So, no, don't stop your Plaquenil. In fact, you can see my videos on how I think Plaquenil should be taken during acute illness. Another follow-up on the Plaquenil was that somebody had seen a video from a physician in St. Louis saying take Plaquenil or quinine and zinc daily. And the only reason I know anything about zinc is because my wife's been trying to get me to take zinc for years. And every time flu season or cold season comes around, she comes around and gives the kids zinc. I've not done that much research into zinc, but I have talked to colleagues who know more than me, including one of the prominent physicians in St. Louis who's been on TV or in the news. And I think they support zinc. I think it's additive. The way it works is it potentially helps Plaquenil work better, and it may have an antiviral effect, and so that's why people think it works for the flu and cold viruses. These are all different viruses. Scientifically, have I looked at that data specifically? No. But zinc and over-the-counter doses, the reason it's over-the-counter is because it's considered safe as long as you follow the directions on the label. Don't take a whole bottle, because sometimes more is dangerous, and there's a reason why they have a dose on there. Okay? And it's not because I told them to. It's because somebody did science on it at some point. So, yeah, zinc certainly probably is not harmful. It might be helpful. Okay? It's hard to find zinc in the stores right now. But I have faith that there's enough zinc in our earth that we will have zincs on the shelves shortly. Okay, almost done for the day. We're doing good on time. So I like this question. Can you get the COVID-19 more than once? And that's a very real question. Really, a very real situation. Technically, yes. Frankly, as I've mentioned in numerous lectures, once you develop the protective immune response, and we can measure that, the surrogate measure of your protective immune response are the IgM and IgG antibodies that either come in the finger stick or the blood test that people are talking about all over the world now. What we don't know is whether it's actually those IgM antibodies and IgG antibodies that keep protecting you. Because to get those, I mentioned this the other day, to make an antibody, you have to have a T cell and a B cell. The fact that you make antibodies to this means your B cell that was fighting coronavirus met your T cell that's fighting coronavirus. And they got together, and this went off to make antibodies that look like this, and this went off to make an army of cells that were cytotoxic to virally infected cells. So the fact that we're measuring a test that tells us our immune system did the right thing does not mean It's the antibodies that are protecting us. Does that make sense? I think it is, but the whole premise of the plasma exchange is based on people think it's the antibodies that are protecting. So it'll be very interesting to know whether giving convalescent serum actually does any good or not. So that's one way to test that hypothesis. It could be we're measuring this test just to make us feel comfortable our immune system got activated. But it could be these are the primary cells that are saving us, because these stay around for decades as well and protect us the next time we see it. When the immune system sees something that shouldn't be there, it creates versions of these cells and these cells that stay around for your lifetime. And they do it in higher numbers than the original single cell of each one that was waiting in your body since you were a kid, waiting for today to occur. And so now you have an army of these cells, and we tuck them away in different parts of our body. As we age, we slowly lose that, and that's why older people tend to get sicker more often, because they lose their protective immunity just through the process of losing your memory immunity. And that's why we sometimes have to get booster shots for certain diseases. But theoretically, once you get this COVID-19, you should be highly protected. If you happen to be a patient that doesn't make T cells or B cells, which are not very common, but there are immunodeficiencies, common variable immunodeficiency. Some kids have severe combined immunodeficiency. If you don't have these cells, you're not going to make an immune response, and you can keep getting the infection over and over again. That's an easy answer. But you guys all know that you've had a flu shot. In some seasons, even when that flu shot seems to be protected, you still get the flu. Right? Is that going to happen? And that might happen. As long as this virus keeps circulating, even though we have an immune response, we might get sick again. But I think it's very logical to reason that your immune system has a head start in that case. That if you get sick again, you're much more protected the second time around. Right? So the answer to that question is yes, you can get sick a second or a third or a fourth time. Will you? Much lower likelihood if you have a good immune response. Most of us make the appropriate immune response after this. And that's why I think testing that, it's going to give you a significant peace of mind, knowing that you can do a finger stick or your doc can draw blood on you before you go back to work to say, yep, you got IgM and IgG, or you have IgG titers, your immune system was activated anywhere from 2 to 6 weeks ago, and I think it's safe. That's what's the discussion going on in our country now. That's what Fauci's talking about now. Okay? And that you guys are asking all the questions that are being asked at the national and international level, which is pretty cool. So, that's my 2 cents for the day. The question I didn't get to is a bigger question, and I think we'll reserve this for next week, because it has some interesting interactions with a bunch of other things on this list. And that's, I'll give you guys something if you want to do your Easter homework. Look up the cell. So if we have a cell in your lungs, and this virus is out here looking like this bad guy, it has to get into the cell somehow. And it does this through a receptor called ACE2, angiotensin converting enzyme 2. And this particular protein lines our lungs, our upper respiratory, lower respiratory, GI tract, our kidneys, and the inside of our blood vessels. That's what I read today. So, again, where the virus is going to see us first is in the lining of our lungs and the lining of our GI tract. I haven't heard about any kidney problems because viruses don't present to the kidney without getting through everything else first. So, that's what we're going to talk about next week. So, bottom line, one of the questions is, if I take ACE inhibitors or angiotensin receptor blockers for my blood pressure, am I at higher risk? Because we know that people with hypertension are dying at a much higher rate than those without. Is it because they're on these medicines and they're upregulating the receptors, and now the virus has an easier entry? So that's what we'll discuss on Monday, okay? All right, guys, have a great weekend.
Thank you.
decision at 3 o'clock meeting.
No, I was going to tell you that. Right? He canceled it.
I'll be here. I'm going to go get lunch right now.
These were stacked up, weren't they?
Oh, I did it. Don't worry about it.
Oh, okay.
Did you say how to turn this off?
Is there a stop button on it?
Get them do a little jig and we'll see.
What's that?
Get them do a little jig and we'll see.
Oh, yeah.
Did you say how to turn this off? I don't see a little on off button. I'm afraid to touch anything. Oh.
No, not letting it. Not letting it either.
There's some stuff over here.
I used to have
I'm
one.
sure he'll be back in a minute though.
Oh, here it is. Right here. Start.